So welcome. This is called the Undergraduate Health Leadership Internship. So we call it UHLI at the Hanley Center. Just a very long name, so we try to abbreviate it when we can. So if you hear me say UHLI, that is this internship program. You're not in the wrong spot. There we go. So who we are at the Hanley Center, some of our applicants in the past have thought that we were the organization directly with the positions. There's a little confusion around that. We are a small nonprofit. We are fully remote. There are 4 of us. Judy Ann Smith, who's our executive director, Janelle Lewis, who is our director of leadership development, and then Maggie Adelson, who is our HR queen. She kind of does all the finances, finance coordinator, and all of that. So we're a very small team, and we are on a mission to work with the health and healthcare field to improve leadership. So we put on courses, we do executive coaching, and we also have this internship program. So we work with everyone from undergraduates all the way up to doctors with decades of experience who come to our courses. I won't read you the slide. Again, I'll send this out to Seth and Kate with the recording. I don't like to necessarily read them word for word, but like I said, our mission is to encourage and grow leadership development towards that collaborative state. And we start at the youngest, I'll say, with the undergraduate internship. So about the UHLI program, we started in 2012. And since then, we've had, these are estimates here, but 300 or more than 300 interns placed across the state, and 40 organizations hosted, or more, really, over 40 at this point, organizations who have hosted interns since that time. And so where our reach has really become quite big over the state, and we have a lot of organizations who come back to us. And then we get a lot of new ones who also join. So we are really looking to get you guys to see the amount of opportunities that are in our state. And I feel like I can say this as someone who grew up here and then left for about a decade. I moved to Massachusetts, and then I came back to Maine because of various reasons. But I left for employment purposes. I am not in the healthcare field as a provider. I work for this nonprofit now. But I did come back for other reasons, and I think those reasons are really important. And sometimes when we are, graduating in our 20s, coming out of grad school, we're quick to write them off and be very career focused, which is totally fair. But there are great opportunities in our state, and we hope to show you that and to give you the opportunity to think that you can have it all. You can have peace and quiet and country and city and a great career. So we hope that you see that connection to Maine. So we're really looking for undergraduates who are connected to the state. And that's kind of what we highlight here. So a little more, we are looking for interns who have a connection to the state of Maine. So that doesn't mean that you have to live here or that you have lived here your whole life. It could mean we've had interns who were from Florida, but kept coming here on vacation homes and had a grandparent here, or the connections are kind of all over the place. It's all about having that connection and really wanting to be part of the Maine community and wanting to maybe even see those career opportunities that we're trying to get you to see while you are in this program. And to know that if you have an interest in staying in Maine, really talk about that and your connection to Maine in your application, because that's really our mission, is to really keep young people here, to show them those opportunities and to keep you coming back and to be proud of that. So that connection to Maine is really important, not only just because of our mission, but in your application and your future. Some of the highlights, you'll see that you become part of an alumni network. I've had, as you see, we've had 3 interns from last year who are part of this info session tonight. We have their contact info. They can call us anytime, use us for connections to anything, references. They can talk to other people who are part of the Hanley network in all of our courses. So that's a huge network that you become a part of. You build connections with your intern peers. One thing that was new last year, and I would say we're going to try to improve it a little more this year. It seemed to be kind of good and could be improved, but we had some Canva discussions going last year. which I found to be at the very least thought-provoking, which was a really great thing. And you get to read what your peers are going through. So that's really nice to see when you have struggles. Like for instance, last year, some people said that they didn't realize that working remotely would be difficult for them, or that working at a desk would be difficult. And they got to see that they weren't alone. They got to see people's suggestions around things, hear stories about what their peers were doing in different roles. So Canva has been a really, or Canvas, did I write the right thing? For those of you who know Canva and Canvas, I mess them up when I type all the time, but the one where you go and you have discussion boards. And then we have Leadership Day in July. So that's the picture you can see here. Our faculty, Bob Wright, does a lot of activities that day, as well as I do a little bit of leading, but we also have alumni come through that day. Seth and Kate are there. They get to have lunch with you and you get to kind of pick their brains on things. And it's really a great day for you to come together as a cohort when you are in the program and get to hear some inside advice from people who are working in the health and healthcare field, who were in this program, how they got to where they are. And it's a continuation of your development through your career. So that one day, and that really seems to be the most favorite part of the program for our interns. And it's a lot of fun. It's very informative. And it's very pretty when the weather's nice. So the application process is all online. I took some screenshots here, but this is our website. At the top, there's sort of this weird submenu that we've got going on. So up there, it says healthcare internships. And I believe too, it's also in this about section. I believe there's an internship thing, but I can't click on this right now. But you will see that there are healthcare internships. You click on that, and then you'll see that this is like the generic, this is the page you'll land on. On the right is this blue box, and it'll say something about applications being open. It might not say exactly this verbiage right here because this is a static picture that I altered a little bit, but this blue box is there. You will see that it says apply now. You will click that button and it'll take you to the internship page, which I can show you in live time. When you get to the application, you will see that you need, and it will walk you through step by step. You'll see the resume. It'll ask you for a cover letter for each position. And I really encourage you to take your time and personalize each letter because that makes a huge difference. Unofficial transcripts, a letter of recommendation, and that letter of recommendation is a separate form. It is linked on the application. So that is something that someone, a professor, an advisor, a boss that you've had, someone of professional status will come in and write for you, and they need to fill that out as part of your application. So all of that really is walked through for you step by step on the application itself online, which I actually would like to zoom out and show you now. Let me stop sharing for a second. I'll just show this real quick. So this is our website. So this is the blue box I've talked about. As you can see at the top, it says healthcare internships. So if you click there, again, brings you to this page. You can apply now. And it'll look like so. And down here, it walks you through step by step. So it explains an essay to you. You will upload it here. Again, I'm not going to read that right now because we have so much to get to tonight. But if you have any questions on this, you can always email me. My email, it'll be on the PDFs that I will send out. You have all your choices. You'll go through and rank your internship of choice. You'll upload your resume, your cover letter. So again, really emphasize writing a cover letter for each position and making it unique to that position. That automatically gets you to be taken more seriously, and it looks like you are much more interested in the job. And a reference. So this link here will take you to that recommendation form. Your transcripts, unofficial is fine. And there's boxes for other additional information that you may need to attach that didn't fit any box. And that's really it. And then at that, you just hit submit. The reference comes in, and then it's on us at the end of the deadline, which is February 16th for now. If that changes, I will let people know. And then we will be in touch after the selection committee meets and looks at applications from there. So that was a lot in 15 minutes that I just talked about. And right before I switch to our interns from last year, I'm going to stop sharing. Our executive director came on. I don't know if, okay, there you are. Hi, Judy Ann. Judy Ann Smith is our
Hi,
executive.
Katie. Sorry, I was late. Lost track of time.
That's
So
okay.
glad you all are here. I don't need to take part and get in your way. I'm just going to be a fly on the wall. But thanks to all of you for being here. And for our 3 returning interns, thank you so much for coming and sharing your insights tonight. And I'll get off now and just watch and listen.
Thanks, Judy Ann.
Thank you.
All right, I'm going to start just with who's at the top. So Caroline, that's you. So Caroline, go ahead and introduce yourself. I'll kind of raise my hand if we're running out of some time, and hopefully I'll keep you on track, but take the floor, all yours.
Great. Hi, everyone. My name is Caroline Grant. I'm a junior at Hamilton College. I'm majoring in neuroscience with a minor in Hispanic studies. I'm currently in Maine. I have lived in Yarmouth, Maine my whole life. And I was fortunate to be one of Hanley's interns last summer. So I was a neuroscience intern for Maine Health. So it was hybrid, but when I was in person, I was either in Portland with the neuroscience department, at Maine Medical Center, or I was in South Portland at the cancer care clinic with Dr. Lou Emerson, who is a neuro-oncologist, and she was an awesome mentor. So I'd love to share with you guys some information about sort of what I did and what I learned, because it was just really exciting. I was mainly conducting research for a neuro-oncology project. So I was compiling some specific data points from just hundreds of electronic medical records of patients who have been treated for glioblastoma in Maine over the past 10 years. So glioblastoma is a primary malignant brain cancer. It's classified as grade 4, so it's really aggressive. And as of now, there's no cure for it. So the goal of the project that I was working on was to sort of create a database of information to give insight and sort of reveal patterns related to how Maine Health has cared for this patient population over the years. So for example, we were sort of looking at, has there been improvement in the longevity and the quality of these patients' lives? So I was collecting data on their initial date of surgery and the date they started treatment, if they had access to clinical trials and what those trials were, if they had access to mental health resources, especially during the COVID years. So we were also looking at if there were any specific medical advancements that have helped to prolong these patients' lives over the years. So again, specific clinical trials that worked well, surgical innovations that we've seen develop. Again, these are just a couple examples, but overall, the project was really just to help Maine Health analyze how it's doing as an institution in providing care for this patient population. And the research that I conducted was really just an initial look at a bunch of data points. Any patterns that might be discovered from my research will hopefully lead to a more specific analysis moving forward. But personally, I can say that there has been a couple significant changes in Maine over the years, which is really cool just to see. So we've seen a lot of clinical trial access change over the years. So Maine Med now participates in a bunch of trials so patients don't have to, travel down to Boston to pursue this treatment option. It's much more accessible. We've also seen medical advancements and new surgical techniques that have emerged over the years. So there's definitely many more patterns and a lot more changes that have occurred that can be maybe analyzed from the data, but kind of cool that just over 3 months of data collection, it's kind of cool to see these changes happen. So a couple takeaways from this internship, I definitely learned how to navigate electronic medical records, which it was a steep learning curve, but really a cool skill to hone. And I have a deeper understanding of glioblastoma, so I'm really interested in science. So it was cool to sort of learn about its origin, its molecular biomarkers, different medical terminology and treatment options. I also got to sort of learn about the different layers of care involved in the healthcare system. And I was fortunate to work in Dr. Lou Emerson's office every Wednesday. So I was exposed to her team and her weekly patient-physician interactions, which was honestly just a privilege to experience. And I guess one of the last takeaways is that this internship really gave me the opportunity to work as a member of a team. So sort of balance being an independent worker, but then also sort of when to reach out for help and ask for guidance. Everyone who I got the chance to work with was so amazing and so supportive. So I feel like I could just keep talking about my experience because I really loved every part of it, but I'll leave it there in the interest of time. And if there are any questions, I'd be happy to answer later on.
Thank you so much, Caroline. There's just, man, that's just so much in 5 minutes. And I know you're like, man, I could keep talking. That's a great thing, Caroline. I don't mean that as an insult. Don't make that face. It was wonderful. Thank you so much, Caroline. I hope there's got to be at least one question that comes from that. Ryan, go ahead. You're next on my screen. So
Hi, everyone. My name is Ryan Reno. I'm a senior at Colby College, and I'm a double major in biology and classical civilizations. So I'm from Maine. I live in Gorham, Maine. My internship this past summer was the clinical integration intern at Martins Point, located in Portland. I didn't see that on the list of available positions this year, but I'll just give you a brief little explanation of what I was doing. So it was in person, and I basically was surrounded by 6 different nurses, RNs, and we outreached to patients for preventative care measures like annual visits, scheduling diabetic appointments, scheduling mammograms, and colorectal cancer screening. So I was scrubbing through charts and patients' charts and lists to see if anyone was due for these and if they were eligible. So my main project was working with diabetic patients. So I would scrub through their charts and see if they were eligible for continuous glucose monitors, which greatly improve how well a diabetic patient manages their blood sugar. And if they were eligible, I was in touch with the physicians and providers to see if they thought it was also something that the patient would do. And then if the patient liked it, we would put it in an order for it. And it was great to hear some people when they, like a couple weeks after they got it, how much it improved. So, and this also allowed me to see a lot of the inconsistencies in the scheduling process as it's for the diabetic patients as it's always up to the patient's discrepancy. So I was tasked with constructing and presenting a standardized diabetic scheduling workflow for Martins Point, and I presented this up to upper management. So they said they would get back to me on what they're going to do with it, but it's definitely the most nerve-wracking presenting in front of the directors of Martins Point. So, and also 2 summers ago, I did another internship through Martins Point, not through the Hanley Center, but it is part of the internships, the network database intern at Martins Point. So this was, as I assume it's going to be again this year, it was a hybrid internship. And basically, I was credentialing providers on the health plan side. Martins Point is both health plan, health insurance, and then they're also the delivery system where you go to see providers. And even though this is not in the delivery system and like you're not on the side that sees patients, you still have access to shadowing providers and you learn all about all the different aspects of healthcare, which I think is really important. Some of the best things at Martins Point and why I chose to return for a second year were the people I worked with. It was the culture. Everyone was great, fun, and we joked around a lot, but when it was time to work, we got good work done. Martins Point has a saying, they want to deliver the care every person deserves. I feel like I personally was involved with that this summer, and it made me feel good. And I know I impacted some people's lives too. So some learning takeaways that I have is always to be thinking of ways to improve current processes and don't be afraid to bring up these changes. I feel like as an intern, you have a unique perspective and your employers will definitely want to hear that and get your fresh set of eyes on it. And as Caroline said, a deeper understanding of medical terminology, and I got to learn all about diabetes too, which was very interesting. Some takeaways from the Hanley Center, apart from like the really good leadership day that we had and learning about health equity. I learned I didn't have a LinkedIn account or network at all, but build up a network of connections with people that may be helpful for future opportunities and stay in touch with them. I think this is really important, and just keep in touch with them as well. So the Hanley Center influenced the way I was going in my career. I've always been on the pre-med track. I still am, but I was thinking maybe nursing and being surrounded with RNs every day and shadowing with nurse practitioners at Martin's Point really opened my eyes and showed me that nursing is something that I would want to do instead. So I'm planning to go to accelerated nursing school now after I graduate. So that was definitely a really good point of this experience. So yeah.
That's fantastic. Yeah, I know, we're all like, "Eh." That's great. Okay, I want to waste anyone's time. Thank you so much, Ryan. Sophia, you have the floor, and I think, Sophia, you're going to bring the non-clinical side of things. Am I right? Yeah. Okay.
Yes, absolutely. Hi everyone, I'm Sophia. I'm from Atlanta, but I'm a senior bioneuro major at Colby. So my connection to Maine is entirely thanks to this amazing school up here in Waterville. This past summer, I was the community outreach intern at Sweetser. Sweetser is a nonprofit mental health care provider in the state of Maine. They serve thousands of Maine families, and they've been a part of Maine's journey since the late 19th century, which is crazy. There's just so much history of their impact for, I mean, almost 200 years. That's just, it felt very meaningful to be in an institution that grounded in Maine's history. I absolutely loved working at Sweetser. I was so supported by my boss and my team. It was such just an amazing environment. I was in the communications department, and I had just so much freedom to pursue the projects that I was interested in and a lot of direction to kind of plan my days based on the facets of Sweetser's care that really spoke to me. I'm a pre-med student, so a non-clinical internship to any other pre-med students, I think can kind of sound like, why? But I truly cannot recommend seeing this side of the healthcare field more. I feel like the information I've learned and the experiences I gained about public health in Maine are some of the most valuable lessons I've ever learned. Working in a nonprofit especially was just so eye-opening to the sort of behind the scenes work that's going on outside of a hospital. I was able to shadow my boss and some members of my team doing like routine visits to some of Sweetser's inpatient facilities and speaking to a lot of the caseworkers who were there and hearing their perspectives on like the just difficulties of working with a nonprofit, how money can be really hard and funding can be really difficult, yet wanting to provide the absolute best care possible. Like, how do you navigate that kind of relationship is pretty difficult. And knowing about, you know, what that struggle looks like and how you advocate for yourself was just super impactful to me, especially someone who I still continue to pursue medical school. And this is something that I'm, you know, is definitely part of my career plan, but knowing what the work sort of outside of the hospital looks like, I think has completely changed the way that I want to approach medicine, for the better, 100%. So my day-to-day at Sweetser wasn't super consistent, which I really liked. I was able to kind of plan out what I wanted to do just entirely based on my interests. I was able to also get pretty close with Sweetser's CEO, Jane Van Bramer, and she spoke a lot to me about what leadership was like in a nonprofit. Well, that's not necessarily a career path I necessarily see for myself. She has a lot of incredible perspectives, especially as a female CEO, that just from a leadership perspective, I've really taken to heart. And it's a small-ish company, and the ability to get to know people in different departments and learn about different facets of how like that professional environment worked was super important to me, especially because I've never really been in that kind of atmosphere before. So both at Sweetser and through the Hanley internship, there's this emphasis on becoming a professional and navigating this pretty new world for a lot of us. And I felt really, really supported both at Sweetser and from the Hanley Center, just sort of asking me questions that I had through the like Canva forum. That was really helpful. And knowing like, yeah, this is my first time working in an office at a desk. What do I wear? What do I say? What's an appropriate thing to like include in an email? Things like that. Or just, there was like a no judgment barrier, which was really, really nice. So I guess the last thing I'll say is the highlight of my time at Sweetser was absolutely going to the Governor Mills's summit on the opioid crisis and representing Sweetser. I'm very interested in harm reduction and sort of breaking the barrier to care to folks experiencing addiction. So this was an incredibly powerful day for me, and being able to represent Sweetser as a mental health care provider surrounded by other people focused on the same or similar issues was really, really interesting. And from that event, I was able to gather so many connections and resources that I've brought back to Colby and, started to begin conversations about this kind of thing at Colby. And these are kind of the experiences that Sweetser really pushes for their interns, and Hanley too. And yeah, I mean, I just feel like I spent a summer in Maine learning about the Maine community, learning about the history of mental health care, and getting a really cool behind the scenes look at what, care outside of a hospital looks like. And this is all such a deeply important kind of background that I know I'm going to, keep with me and take into the next 6 years of my life working in a hospital. So yeah, I'd love to answer any questions if anyone has, especially about the non-clinical side. And I think that's all I've got.
Thank you so much, Sophia. Thank you guys so much, especially, I know I like Sophia when you talked about the, why would you do a non-clinical internship if you're heading down a clinical path? And I think you brought a really important point to view of getting that behind the scenes look. And all of our internships are fantastic, but it made me think to share this too, because our policy intern, a lot of people look at that and go, why would I want to be a policy intern? But I will tell you, I know on paper you're like, oh, that doesn't sound exciting, but one of our internships with Maine Medical Association, we get advice, or we get feedback like that too, because they see a lot of behind the scenes of how health laws and things are made and what's done behind the scenes, and it really opens interns' eyes who get to be in that role. So, but all the internships are great. It just made me think to share that. But anyway, thank you so much, Caroline, Ryan, and Sophia. We are going to do a question and answer session, but we're going to have Seth and Kate take the floor first, and then we will have Q&A starting right at 7:45, 7:46. So Seth.
Hi, everyone. Seth Ramus. I'm the pre-health advisor at Bowdoin College, and I've been involved with Hanley since the very beginnings of the UHLI program. I have literally read decades of applications for this, and so I'm hoping that I can give you some feedback on the things that we see. One of the most important things I think is really that I want to emphasize what Sophia was saying, that you guys have a tendency to get a little, you see what you should be doing sort of in a box, as sitting at a bench doing research or fiddling around on the insides of people. And you'll learn very quickly that unless you have a license to practice medicine, you can't fiddle around on the insides of people. And so clinical experiences look very different than you might imagine. The internships in this program are all amazing and all appropriate for all of you. We work very hard to create these opportunities that will be really helpful for you in your career moving forward and allow you to see what healthcare really looks like, not the TV version with the spurting blood and things like that, but the actual way that healthcare works and the way that healthcare organizations work. The people who are offering these internships are people who are Hanley alumni, and they are really dedicated to creating opportunities that will entice people, young people, to become part of the Maine healthcare workforce. We are really facing a healthcare workforce shortage, and this is a carrot to bring you guys in and see that there are incredible opportunities in our state. So when you're looking at the internships, we tend to have some that look really exciting and sexy, and we'll have 100 students applying to 2 or 3 of the internships, and then we'll have 2 or 3 internships that there's only 1 or 2 people applying to. So just as a warning to you, think outside of Portland. Think about the ones that may not sound as exciting, and understand that people are going to give you incredible opportunities in all of these internships. Obviously, if you are one of 2 people applying for an internship, you're much more likely to get it than if you're one of 100. So look broadly at both the sites and the locations and use your imagination. The policy internship is a fantastic example of that. You know, there are some really wonderful internships out there, and so look at them. If you have questions about them, please feel free to reach out to any of us with the Hanley Center. As far as your application goes, Katie was talking about the purpose of this internship, right? It is really about creating and encouraging you and introducing you to the Maine healthcare workforce, and to give you networks in our state. So if you start your cover letter with, although the internship is in Maine, you're not going to get a lot of excitement from us advisors who are reading your application, right? This is really about looking to provide opportunities with students who have connections and are interested in staying here. So make sure that that's reflected in your application. You know, get beyond sort of the title, the leadership, and really look at the mission of the Hanley Center. Just sort of more nuts and bolts. When you are writing your internships, you get to choose the ones that you're most excited about, and you get to rank those. We will try to give you as close to the first place one that we can, but we really try to make sure that we have good people in all of the internships, so we may not be able to give you your first choice. But please take the time to individualize your cover letters to each of the individual sites that you're writing to. That really goes a long way. And it's not just, you know, in terms of the names that you're writing to. Think about the skills that you have and the skills that they're asking for in the internship. So we often have, you know, an internship where they're doing social media. Don't assume that because you're 19 years old, we understand that you have social media experience. You know, make sure that you talk about your social media experience in your cover letter. If they are asking for Microsoft Excel experience, make sure that that's on your resume. Please make it easy for us. What we're going to do is we're going to try and match individual interns to sites, but the sites ultimately are going to make a decision about your fit with their organization, and they may in fact interview 2 or 3 of you for the spot. So make it easy for us to forward your application by really showing off the skills that they are looking for. And in sort of the last thing that I would offer to you is that these are all paid internships. We have worked really hard to make them paid internships, and we ask you not to ask for academic credit. That adds an additional burden to the host sites, and we have opted for paying you for the summer rather than giving you academic credit. Okay? So please don't ask them, even if you are awarded the site. All right, that is all I'm going to say to you guys right now. And I will leave it to Katie to post questions, but I'm here to answer them.
I'm going to
Kate,
jump
are
in
you going to jump in?
with one more piece of advice. In addition to tailoring the content of your letters, I really encourage you to work with your campus career center advisors and or your health professions advisors to make sure that you are presenting a well-constructed professional set of documents, your resume and your cover letter. There are traditional expectations for these documents that you submit in an application, and the closer you come to meeting what professionals expect to see in these documents, the stronger your application will be. So don't hesitate to reach out and ask, how do I format a cover letter, or how do I format a resume, and get some help and review of it with the resources that you have on hand on your campus. I think that was the only other thing that I was going to mention, except that one of the huge benefits of this, and Seth and Katie have both mentioned this, but it's worth reiterating. I like to say, I'm a native Mainer, and I like to say Maine is a big, small town. And I live up in Waterville, but seems like every time I stop at the Kennebunk rest area on the highway, I run into somebody I know. So it really is that kind of a place. And you are, by participating in a Hanley internship, you are establishing a ready network of professional contacts that will welcome you back to the state, or welcome you to jobs in the state once you finish training in whatever healthcare profession or part of the profession you end up landing in. So I'd just like to reiterate that. Now, go on with questions and answers, Katie.
Thank you so much, Seth and Kate. So we're going to open the floor 5 minutes early here to questions. Feel free to ask any one of us a question. I'm assuming they will not be for me, but Kate and Seth and Ryan, Sophia and Caroline are ready, and hoping you've got a couple of questions for them. Danielle?
Hi, I actually had a question for Sophia regarding your internship and the non-clinical aspect of it. As a pre-health student, I was wondering, did the non-clinical aspect help you clarify any of your future goals or aspirations, like with what you want to do specifically in the healthcare field?
That is a really good question. I think so 100%. I learned that I don't really want a desk job. It's as valuable and as fun as the summer was. I, from a physical perspective, just love to be on my feet. But I also think that the constant patient interaction that being a physician provides is slightly more appealing to me than being more behind the scenes. But from like a more positive note, I think that understanding sort of because I do want to stay in Maine as a physician. That's a big goal of mine. So fingers crossed. But understanding sort of what the non-clinical support resources look like in Maine, and having those sort of in my back pocket is like, hey, hospital visits are daunting and expensive for a lot of folks. Here are a list of resources that are provided to you from a couple different places that may, better serve your needs at this time. And knowing what those are and what kind of advocacy and support I can provide as a physician to, like, based on, nonprofits like Sweetser, and there are a few others, just made me feel like more prepared almost for going into that next sort of pre-health career step. It's also just made me feel much more connected to Maine, which I think just as I continue to pursue looking at, jobs and staying in Maine as a physician, I think that just was very, very meaningful. But yeah, I think that, I don't know, the non-clinical perspective definitely reinforced my want to be a doctor and to go to medical school. And it also confirmed that, like, care is the bottom line in a lot of these professions, and having the right resources to provide to people, even if it's not, direct resources from the hospital you work at or the doctor's office that you lead, that is really meaningful. And, we are doing these things because we want to help people, not because not, any other reason. So does that make sense? Okay, awesome.
Yes, thank you so much.
Thanks, Danielle. Is it Nana?
Looks like the lady that, yeah, that's Nana.
Hi, Nana. Go ahead and ask away.
Yes, so my issue is that I'm a military veteran. I was a combat medic, but did most of my time in the hospital, a multi-trauma unit where I work with like a lot of doctors like neurosurgeons, orthopedics, trauma surgery, cardiothoracic, whatever. Have all these experience, these management stuff. But it's like it's hard when I'm applying for these internships because I see that a lot of people don't value the military experience and then whatever I did with direct patient care and then management as well. And a lot of them also would be like, you need to complete certain requirements like these science classes, like their biology, organic and stuff. And it's like, because we don't have that, it's been hard for like veterans at Fordham who are pre-health students to even get all these and, like kind of add them onto whatever we have on our belts so we can go to the med school. So just asking, do we just have to forget about all these and going to maybe volunteering? Because I think that would have been like a good shot for me, or just keep putting in like everything on, getting an internship, which is gonna be paid.
I'm not sure that not sure that I have advice here. Are you in a university or college in Maine right now?
I mean, for
I say your connection's a little poor too, so I don't know that I heard that.
He
Judy,
said he's at Fordham. I think he's at Fordham University. Seth, do you have an answer?
Seth?
Yeah.
Kate looks like she's
Oh,
leaning
sorry,
in.
Kate. Yes.
I would suggest this is actually a great conversation for you to have with your pre-health advisor on your campus, because maybe this isn't the right internship for you, but they should be able to help you identify what would be appropriate next steps and resources to help you find them. So I encourage you to read the descriptions of the internships that are offered and determine if any of them do seem like a good fit for you. And if you can, demonstrate a connection to the state of Maine, that will make you eligible for the ones that you want to do, by all means apply. But certainly, there are lots and lots of other opportunities out there. And I think your health professions advisor or your career center on campus would be a good place to go for help in exploring appropriate options that would get you in going where you want to go.
I say that lost the screen. Nana, did that answer your question for you?
Yeah, that in. Thank you.
Awesome. You're welcome. Kennedy.
Hi, my question is for Caroline. You mentioned before that you were paired with a mentor. How would you characterize the support that you got throughout the program? And have you seen a continuation of that support after you left?
Yeah, that's an awesome question. So one of my mentors was Dr. Lou Emerson, who I mentioned. She was the one at the cancer care clinic in South Portland. And then I also had Jared Sawyer and Sarah Cox, who I worked closely with at Maine Medical Center. They were in the Neuroscience Institute. And I would say that it was I was mostly actually with the Maine Medical Center. People with the Neuroscience Institute, and they checked in with me frequently. Basically every day we were exchanging emails, and I have kept in touch with Jared, and he has helped me with recommendation letters. I also have kept in touch with Dr. Lou Emerson. She also has been really awesome in providing me she went to medical school, and that's I'm on the pre-med track. So she's helped me sort of with connections and giving me some advice. I actually have emailed her somewhat recently because I'm trying to figure out my next summer plan. So I would say that's why this internship has been really special, is because I have been able to keep these contacts, and they reiterated that they're there for me and for, support, because I want to come back to Maine and give back to the state, and that's exactly what they're doing. So, yeah, it's been a really special connection, and I have seen it sort of continue even past the summer. So I hope that answers your question.
It does. Thank you.
And I'll emphasize that all of us advisors have stories about students who have parlayed these summer internships into postgraduate jobs. And we've now been around long enough that our students have gone away to school and earned clinical degrees and come back and use their Hanley connections to get their first jobs in Maine.
Danielle?
I have another question regarding a more technical aspect of the application process. I'm a transfer student, so I have more than one transcript. Does the application itself allow me to upload all of them, or should I just upload the most recent one that's applicable?
That's a great question. You can upload all of them. And if you need that additional box at the bottom of the application, you will see it says any additional files. And we did add that last year because we had a student who was studying abroad. And Sophia, that wasn't you, was it? I feel like that was.
It might have been. I think so. I was studying.
I don't know why I thought that was you, and I don't know why I remember that. But impressive that I remember that, and some other things I forget. But anyway, to answer your question, yes, you will have plenty of room to upload all of your transcripts, and there is additional room at the bottom of the application, so you can upload any other files if you need to. And if you do have any technical issues uploading anything, you can always send your files directly to me, and I can go in and put them up on the website. So.
Thank you.
Yeah, you're welcome, Danielle.
Oh, which reminds me, we're still asking for Word or PDF files, I believe, Katie?
Yes, PDF files.
Yep. So please convert everything to PDF files for us. We really struggle every year trying to figure out what your file extension means, and a lot of times we end up not having a program that can convert for us. And we don't want to miss your wonderful application because you used a file format that we did not support.
Yeah, especially with Google. I had a couple applications last year who sent me Google links, and I love Google. I love using their interface, however, not for this process. And if you send it to me and I don't have permissions, then I have to email you and it delays your whole application. So please send in PDFs. Seth, were you going to add to that? Okay, looked like you were on the edge of your seat, ready to add something for a minute.
I'm ready to answer questions.
Okay, I'm going to go in the order of how you three come up on my screen. So Victor, you are first.
Hello, can you hear me?
Yes, you're loud.
Okay. So I have a question for Ryan. Is there anything specifically about your internship that made you change your mind into like maybe going into nursing? Because I have a couple of friends on, I'm in the pre-med track, and I have a couple of friends that are on the same pre-med track, and they've actually been thinking about the same thing. Is there anything like specifically about the internship that made you change your mind?
You're muted, Ryan. I just asked
Sorry.
him. You're good.
So one aspect was I never even really considered nursing at all. I never thought that nurses, like nurse practitioners, I never knew about that before college, before recently. So definitely in the aspect of nursing is so widely, like you can hold clinical positions, you can hold administrative, you can switch specialties. So just the knowledge of my past, the nurses surrounding me really helped. One of my supervisors was a nurse down in Louisiana for 20 years, and then she came up to Maine and took a more administrative role. And then if she always told me if she ever wanted to go back into the hospital setting, she can. So it's just it's really nice to have that type of flexibility too, I think, in the future. And it's definitely the work-life balance I saw nurses having too. And I'm not sure if I would ever, if I do become a nurse practitioner, go into primary care, but seeing and shadowing nurse practitioners and MDs at Martin's Point, I definitely can see a better work-life balance in primary care as well. So,
All right, thank you so much.
Thanks, Ryan. Hallie? Or Haley? Did I say that wrong again? Sorry, Haley. You probably get that all
Oh,
the
you
time.
got it. It's Hallie.
Cool. Okay. Hi, Hallie.
Hi. I have another question for Caroline. You mentioned that your internship was hybrid, online and in person, and I'm wondering if you found it at all more difficult to foster connections and build relationships, and how you managed that.
And that's another really great question. I would say it was a little bit difficult to foster the relationships just because I don't know, like everyone had their own like everyone was very busy. Like it's a very busy place, Maine Med, especially like over at the cancer care clinic. So I was, trying to figure out, like I said, like balancing the asking for help and like reaching out and also just kind of like putting my head down and doing the research that I was told to do. So on the days when I was home, sort of working on a monitor, it wasn't as fun, but I was able to still like communicate with the people that I needed to on my team. I would say I definitely preferred being in person, and it was a lot easier just to pop into their offices and say, hey, can I ask a quick question? And I think that it was easier for them to sort of build that relationship with me when I was in person. But there was sort of limited space. Sometimes when I was in the hospital, I would go up to the library, so I would be on my own. It was easy to foster the relationship with Dr. Lou Emerson just because I was literally sitting in her office, like at her desk. She was really nice to let me do that. So we got to chat in her free time. But yeah, I would say I got to foster as good of a relationship as I could with everyone. While also just keeping in mind that everyone was really busy. So, trying to balance that, like getting to know them and having them help me, but also just kind of like doing what I had to do. Yeah, and I hope that answers your question.
Yeah, that's perfect. Thank you so much.
Yeah, it's certainly a different world we live in, trying to respect people's time, but also not knowing exactly what they're doing because you can't see them, and it's a whole thing. Blessing, you're next.
Can you hear me? Okay.
Yep, you're
Okay,
good.
cool. So my question was actually for Ryan and about the presentation that you were preparing. So when you were preparing that presentation, how much of it was sort of like your own personal work and how much of it was you asking other people for help? And if you did and when you did, how did you go about doing that, especially if you were like if you weren't there in person to ask them for help? Like how did you go about doing that to make sure that you like had everything ready before you presented it to the board?
yeah, so my this past internship was in person, so everyone was always in the office with me. So I think it's always great to ask questions. I definitely relied on their clinical knowledge. It was towards the end. I took the last few weeks of my internship to really hone down, and I made sure they reviewed it and they helped me make this workflow. But yeah, I would ask a lot of questions. But yeah, it was primarily my work and through my experience and how I think. And I would sit down with them and just bounce questions off, and they were great. I would present my ideas in like a room, and then all the nurses would be shooting me ideas. So it was helpful that way. Um, and then they were really helpful too, and I would present to them over and over to make sure I was good, because presenting in front of the board is really scary. So yeah, it's I like asking questions because I want to make sure everything's right as well. So I think at Martin's Point they really have a culture that lets them lets you feel comfortable in talking to your superiors and asking questions. So
All right, thank you.
Sorry, Seth, I think I asked to unmute you. That was a mistake. Sorry, got a little click happy there. Is it Safina Singh?
It's Safa. Sorry, that's my last
Safa.
name.
Gotcha.
I just had a question about the actual application. I'm looking at the website, and for like summer 2024, it says that there's 17 different options, but then on the actual application, it says that there's like a few. So I was wondering, or like there's like less. So I was wondering if that's just something on my end, or if all the options are like going to be on the application. Like
Yeah,
an example.
So I'm glad you brought this up because it gives me a chance to clarify this a little bit. There are 17 internships posted right now. Excuse me. But what we want you to do is to really try to focus on your top choices. And in years past, we have only had interns rank 3 choices. And we did say that this year we would open it up to 5. So if there are 5 of those 17 that you want to apply to, you can do that. If there are more, please reach out to me and we can talk about that. We don't want to have interns get application happy, because once you start doing that, it will take the meaning out of your application. And we really want you to pick positions that you feel you'd be a good match for and genuinely are interested in. And we want to give you a good balance of that, to give you as much opportunity as we can, but also not to just free for all it, because that ruins the whole experience for you. And then you may end up somewhere you don't actually really want to be. So that being said, it allows you to pick your top 5, and then on the application, there's a header that says to rank them. So you can rank which one is your first choice. It's a little drop-down menu. And when you click on that drop-down menu, you'll see all 17 positions listed there. And then you can click which one is your first choice, which one's your second, third, fourth, and fifth. If you only do 1, that's fine. If you do 5, that's fine. It's totally up to you. And then at the bottom of the application, you'll see when you go there, it does say if more internships get added at a later date, because that has happened. If you want to be notified about that, you can check that box. And then if they do get added, we'll reach out to you and say, if you want to consider this, it's been posted. So hopefully that clarifies that a little bit for you.
Thank you so much.
Awesome. We do have one more question, and I want to take it, but I also want to be respectful of anyone's time. It is actually now 8:01. So if anyone needs to sign off, we get it. Life goes on. So, but I do have one more question. So Isabella, you'll be the last question of the night. Take it away.
Sorry, this is a question for Caroline. I was wondering if any of your experience in the clinic was patient-facing, or if there were any skills that you learned through doing your research that you think would help you in patient care settings.
Totally. Yeah. So in the clinic, I did have the opportunity to shadow a few consultations between Dr. Lou Emerson and her patients. She would just tell me at the start of the day, you know, this patient, I'm gonna have you come into this consultation and sort of give me the schedule. And so I just kind of sat in, and that was just a really cool experience to just sort of understand the vulnerability and the hardships and also the strength involved in those types of diagnoses. It was really special to be able to see her interact. And I think that's sort of really what pushed me into like, yep, I'm sure I want to be pre-med, like I want to be like her. And in terms of the research that I did, I have really gained an interest in oncology. So I think sort of it was specific to glioblastoma, but I got a sense of a bunch of different types of brain cancer, sort of a better understanding broadly. Obviously, there's a ton to learn, but I think that it's sort of narrowed down like a little bit of an interest that I might have. So I think the research has really helped in that sense. I hope that answers your question. I don't want to go too far, but yeah.
Great. Well, thank you guys so much to our interns from last year, Ryan, Sophia, Caroline. Thank you so much for being here and offering that value to everyone. We really appreciate your time and your experience. So thank you so much for being a part of our little nonprofit here. Seth and Kate, thank you so much. As always, we love your expertise. So we appreciate your time. And to the rest of you guys, good luck on your applications. Take your time. You have until February 16th. Reach out should you have any questions. And if I can't answer them, I'll get you to someone who will. So please reach out if you need it. But thank you for joining us. We look forward to getting your applications.